behalf of the legislature of Guam, I want to assure each and every one of you that our utmost priority is your safety and the protection of your families. And that as we learn and we adopt our procedures and our policies every single day based on what we are learning in different states and different countries that are affected by this virus, that we are going to keep that as our priority, and that we know that we are, despite what we are facing in decreased travel, that we are very resilient. And it's because of you that we are going to be able to ride this out, and we are going to be able to rebuild our industry, and we have done it in the past. So we know that if we can take care of you, we are going to take care of our economy, and we are going to succeed in this effort. And I want to thank all of the people in every agency and in the industry that is really taking care of Guam. And I want to thank each of you for each of your individual efforts to protect ourselves, and to protect your families, and in turn to protect our industry. Situas Masi. Thank you again to all panel members.
Next up, I want you guys to welcome our next speaker to the podium. Let's give it up for our President and CEO of the Guam Visitors Bureau, Ms. Pilar Leguardia.
our government and industry experts, and our chairman of the board, our vice chairman, and other members of our board of directors, members of GVB, our industry partners, and our stakeholders. Thank you for being here. The Guam Visitors Bureau and our tourism industry partners have been monitoring the coronavirus situation very closely. The industry is collectively and actively dealing with the threat of the coronavirus. It is covered on every news channel, locally and around the world. And make no mistake that Guam, along with the rest of the world, is taking this very seriously. The situation is rapidly changing, and we are constantly adjusting to it. The GVB team continues to monitor Guam's source markets, and we are in close communication with our overseas marketing rep offices and all of our key partners. In the past few weeks, we reported that Guam received more cancellations for travel between February through April, and from our major travel agent partners as a result of the global health issues. These cancellations are primarily for packages that include air travel. It includes accommodations and tours. Total cancellation is now a little over 15,000. And the economic impact for this loss is over $9.1 million between February through April. Thankfully, as of press time today, Guam remains coronavirus free. We are working diligently with our source markets to monitor the situation and to keep the channels of communication open. Travel agents have been rebooking cancellations from Korea, and the latter part of the spring and into the summer, we're seeing that happen, so this is some good news. We are continuing to practice good hygiene and to avoid spreading germs, so we must continue that very vigilantly in our community. And we would also like to ask that everyone continues to extend our warmest holiday spirit to our guests. This is a very uncertain time for travelers, and being on Guam may feel like a place where they can get away from it all. We have gathered everyone here this morning so that we can come together and learn more about the coronavirus and deliver the most up-to-date information and facts. We hope that the information that you gathered this morning will be shared among your team members as well as your family. Most importantly, we want to avoid the sharing of misinformation. Our community needs to have accurate information from the subject matter experts that we have today. GVB is part of a multi-agency group that is addressing this issue locally. Now, your Guam Visitors Bureau's role is to share information so that we can all do our part to stay safe and to keep our visitor industry working and get people where they need to get to. In line with the GVB's mission, our concerns and our priority are the health and safety of our island. The Department of Public Health and Social Services is taking the lead in receiving direction from the Center of Disease Control and Prevention. We have met daily with many of these leading agencies to implement the plan that minimizes the risk to Guam and to keep us safe and healthy. We must continue to stay well informed about this ever-changing issue, but we also must rely on credible sources of information. It will help us avoid unnecessary panic. All reputable information and updated information can be found by the Joint Information Center. We encourage our residents and our community to obtain the most current information, the most accurate information by visiting the Homeland Security, the Office of Civil Defense website, and the Center of Disease Control's website. Your Department of Public Health and Social Services is also taking calls for anyone who wishes to learn more information. So I'd like you to write this number down, 635-7447. 635-7447. That number is at your disposal to get the latest information or any questions you may have of concern. We'd like to emphasize that Guam remains a safe destination, and we will continue to do our parts with our stakeholders to be well informed and to diligently work together to keep and prevent the risk to our island. Si tulas masi, and once again, thank you for being with us this morning. I would like to now turn the podium over to Josh to present our guest speakers.
Si tulas masi, Pilar. And we'll be hearing more from Pilar in the second part of our Q&A session. So if you have any questions, please hold it for them. And now we're getting to the part where our subject matter experts are going to be sharing their insights and updates on the coronavirus. Let's welcome our first set of panelists. I know they have a great presentation for us here today, and I'll hand the mic over to Mrs. Linda Impinko Denorsi. Or Dr. Gianni Mendoza. Yeah, sorry, that's not Linda.
Or Danny.
Okay.
No, we switched the order a little bit before we got here. Okay, next slide. Okay, there. Okay, next slide, please. So, the first slide is, what is this virus? It's a new one. There's a large family of coronaviruses. Some affect humans, some infect animals, and then we've got the nasty little ones that mutate and cross over from infecting animals to infecting people. The current thinking, the jury's still out, but the current thinking is that this one may have originated in bats. Is this too loud? No, are we okay? They think this one may have come from bats because when they looked at the DNA sequence, it was about 99% match, and it hasn't mutated much, so they think it's fairly new. So it causes respiratory illness in people, and it can spread from person to person. First identified in Wuhan, China. It varies on the source that you're reading as October or December 2019. I want to say before we even kick this thing off, we are all watching an emerging brand new virus. So all the data is ongoing, it's going to change. What we tell you today will probably change by tomorrow. So we're all going through this together. So many of the stats that we can quote you come from retrospective data, and this isn't retrospective yet. So know that the figures and the information that we relay to you is from the CDC website and from current readings. Next slide. So what are the symptoms? Like anything else, I mean, the lungs can only react a certain way to 2 million illnesses. You're going to get cough, shortness of breath, you might get fever, you might get nausea, you might get diarrhea. Those are a little bit lower on the list, but it looks like just about anything. It looks like the flu. So however you feel with the flu is pretty much how you'll feel with this. Remembering too that most of the common colds are coronaviruses that infect humans. This is not the same. This one's a little different, having come from the bat, as far as we know. Next slide. How does it spread? Good question. As far as we can tell right now, well, how does anything spread? Some things spread if you touch it. Some of the recent data by World Health has found that, for example, chickenpox, flu, a lot of things that we are already familiar with live a couple hours on the lab bench. In Germany, they found that they don't know if it makes a difference in transmissibility, but they found that this one can live 9 days. So a lot longer. And we don't know though, is it transmitted by touch? Don't know. We feel that it's most certainly spread by droplet. If you cough and sneeze, those droplets go somewhere, and if that lands in your mouth, your nose, then you have a good chance of becoming infected from that. Depends on your age, your immunity, your chronic disabilities. And also some new data is showing that it may be spread by air. How is that different? Because without droplet spread, if you're just in the airspace of it, then you may be able to contract it. So that makes it a little more transmittable. Right now, the transmission dynamics aren't known. We don't have all those answers. We just know some right now. So watch the air, watch the droplets, because I think those for certain are ways to catch this. Next slide, please. Okay, now to discuss the layers of prevention, we have Director Linda and Pinkham DeNorsey.
Thank you. There are 3 layers of prevention. The healthcare providers are key because they're all in their clinics, and any patient that is ill, they'll go straight to the healthcare facilities. And as you know, we have multi-healthcare facilities on Guam, and we've already given all the alerts to all the physicians, letting them know that please, if you have any patient that may be suspected of having coronavirus, to please report it to us. The next layer is infection control. And the 3rd layer is education on proper cup etiquette and hand washing. Now we have at Public Health provided infection control training throughout, inviting all our healthcare facilities. We send out already 75 letters to all these facilities to complete an infection control assessment. And this assessment assesses all kinds of questions about their basic infrastructure in their healthcare facility, asking about their safety, do they do any surveillance checking, do they do any disease reporting, hygiene and protective equipment, do they don and doff off these equipments, respiratory hygiene and cup etiquette, and the environmental cleaning. And what I mean by environmental cleaning is just the proper disposal of used needles in a Sharps container and the proper bagging and disposal of biohazard bags. We have also done N95 fit testing in various locations, and medical evaluations have been done, respiratory test demonstrations, and also the fit testing. We've done it through all our Northern and Southern Region Community Center staff, comprised of about 23 staff. Also, we've contacted UOG faculty and senior students in Guam Community College and all our DOE nurses. And we asked them, should this event occur, we want to prepare for the worst. And so we need to increase our nursing capacity. So whether we need to mobilize some nurses at the airport or in the vessel or at the community health centers or even at Guam Memorial Hospital, they're ready to roll. They'll be so cross-trained that we can put them at any of these locations when the need occurs. The 3rd layer of prevention is education on proper cup etiquette and hand washing. When you wash your hands with soap and water, please do it at least for 20 seconds. If there is no water, you can always use an alcohol-based hand sanitizer. Hand washing really starts at home, with your children, with your family. I made this a very big habit with my father-in-law, who's 92 years old. He doesn't like to wash his hands, so he's so well trained to keep hand washing. Whether he touches anything, hand wash. Before he eats, hand wash. So I cannot emphasize that enough. Our wonderful staff at Public Health have developed wonderful educational materials which are available here at the back, which has so many different types of techniques on hand washing. And we will be disseminating those out already to the various schools. And so that will be made very much available. And so you as parents and you working in the hotel industry can really emphasize all these posters and post them up at your different bathrooms and around the hotels, and that would be very, very helpful. When you cough or you sneeze, you have to cover your mouth with a tissue and then throw the tissue in a receptacle. Or if you cough and you have no tissue, use the sleeve of your hand and cover yourself so that all the air droplets don't go out and contaminate anyone. And of course, after you cough, you avoid touching your hands, your mouth, your eyes, and your nose, because this is a way you can get also the virus in your system. And avoid very close contact with people who are sick, and then also clean and disinfect touch surfaces and equipments. And also, when you're sick, please don't go to school or go to work. Just stay at home. Home isolation is also key in preventing the spread of this virus. And if you haven't had your flu shot, flu shot is for the prevention of influenza, we encourage you to protect yourself. Of course, it won't protect against coronavirus, but it does protect against other common respiratory illnesses. Next slide, please. And education is key. I cannot emphasize that so much. We've established lots of educational materials. Also, at the airports, we've developed these health cards, so in case any person that comes out of the aircraft is asymptomatic later on, they may develop any type of symptoms, whether it's cough, as Dr. Melonia mentioned earlier, or it's runny nose, or it's any type of shortness of breath. These are key, and this health alert card really notifies the passenger that they need to seek some type of help, to contact public health, and all our different numbers that are located. They've also been translated to the various languages, and that was with the help of the GVB. And thank you, GVB, for doing that for us. And that is also going to be made available at the front desk of all the hotels. Education, community outreach, we've done so many already. We've done coronavirus presentations with Dr. Thane Hancock, constantly updating the medical community at GMH during their grand rounds early in the morning. We've also done lots of talk shows and also public service announcements, and of course all the pamphlets and posters that have been developed. And continually funneling this through our health professional licensing office, so it doesn't just go to the healthcare providers, it also goes to the different associations, whether it's the Pharmacy Association, the Guam Nursing Association, and what have you. We've also updated the emergency system for advanced registration. That's what we call ESAR, Volunteer Health Professional, or VHEP. That listing is for all the health professionals. There are about 200 on the list, so in the event that we may need to activate additional staff on top of our capacity, we can activate them during disasters or any type of emergency as the need arises to activate them. Next slide, please. Now, I want to emphasize that the testing of the coronavirus is only, and I repeat, only for individuals that meet the US CDC criteria for a person under investigation. And you're going to find out what those criteria are in a minute with the other staff that will be providing that information to you. The specimens must be collected by the healthcare facility. We at Public Health won't collect the specimen sample. That will be done by whatever multi-clinic or multi-healthcare industry that you go to, whatever it is, whether it's the doctor's clinic, FHP, take care, or whatever. And more of this guidance will be also made available through the US CDC Emergency Operations Center. And that website is available, as you can see, on the blue heading. Next slide, please. So currently, what do? We at Public Health will package all the specimen samples and we have to send them out to Atlanta, Georgia. That's what we're doing right now. There have been no cases, so no specimen samples have been sent at this point in time. And what happens is we send it to Atlanta for, it gets there about 2 days, about 6 hours to conduct the tests, it will be done, and then in 3 days we get the results. Once the results are given to us, our public health medical director will also be in consultation with the medical provider in the community, and then they will talk about other things that need to be further discussed with the patient's treatment. Next slide, please. Now, a lot of you have heard on the media that US CDC has already identified and has developed some test kits. Our test kits will be arriving in about 2 weeks. But what we just found out through a conference call that I attended online through the Association of State and Territorial Health Officials is that some of these test kits are good, some are not. What I mean is some states have been having issues because of an assay. And so what we're finding out is that they have to be validated the minute they're received, and they have to be run. If the test doesn't show a conclusive result, in other words, it's a conclusive result, we have to tell CDC, US CDC then will send us another test kit. So that's what they're finding out. As you know, this is very new. They had to move fast to get this test kit out. So this is an issue that was identified, and they have already worked super hard to rectify this in a fast pace. Finally, we do have our ABI 7500 test equipment at the Department of Public Health. It has been revalidated and recalibrated, and we're ready to roll to conduct testing not only for coronavirus, but also influenza and dengue. Now, I'd like to call upon Annette Huggin. She is the CDC administrator to talk about Guam pandemic response.
Thank you, Linda. For those who've been around for several years, back in 2007 and 2008, U.S. federal government made a big push to have their states, local, and territorial jurisdictions prepared for any type of pandemic influenza due to what we experienced with the SARS outbreak back in 2002-2003. So, in conjunction with our multi-key stakeholders, the Department of Public Health developed Guam pandemic influenza, or PAN-flu plan. And so we are currently updating that plan to address other novel respiratory illnesses. And so that is already being reviewed chapter by chapter. And so that we can update our plans and ensure all our key stakeholders are involved. And so in the next several weeks, there will be an invitation out. There are several key stakeholders here in this room that will be invited to ensure that we have a well-rounded, updated plan to address not just pandemic flu, but any other type of novel respiratory illness. For the Department of Public Health, on a day-to-day basis, we do surveillance. There are different levels. We do it at the healthcare provider. We do it within public and private facilities. We do it at our ports of entry. So the response to these ports of entries are not something new just because of coronavirus. It's something that we do on a day-to-day basis. However, if the need is required, we will implement enhanced surveillance, similar to what we did in pan-flu response, as well as our FESPAC because of a mass gathering that we were hosting. On the day-to-day basis, again, we want to emphasize to our partners, there is the required reportable disease listing that health providers must report to public health. So this is in addition to syndromes that we want to monitor, such as like illnesses. Our director mentioned earlier about the layers of prevention. So again, effective prevention and control is not just a Guam responsibility. It's at the individual and business level as well. You need to stay home if you're sick. Keep your child home from school if they're sick. Make sure when you're traveling you're safe, you don't bring anything back. In regards to our healthcare facilities, as I mentioned, we're doing an assessment, and it's again a partnership. Guam cannot do this alone, and so we are working with our healthcare facilities to determine capacity and to ensure what's our next step if there's a need for overflow, and to tap into our public and private partners throughout the island. Next slide, please. The clinical disease response plan, as I mentioned, this is not something new. We do it on a day-to-day basis in conjunction with our partners at the Guam International Airport, as well as the Port Authority of Guam. So each of these agencies have their own communicable disease response plan, and should an ill passenger be entering into Guam via air or sea, we have the air tower being notified by the airlines, We have the seaport being notified by the captain of the shipping vessel, be it a cargo or a cruise ship, to notify the harbor master. Public health is then called by our ground customs and quarantine partners. We try for that 1 hour before they arrive, so that we can activate, if needed, our response team, which consists of a public health nurse and a Bureau of Communicable Disease Control staff. When our territory epidemiologist, who I'll be introducing shortly, is given that call, and this is a 24/7 call that we get of an ill passenger, she consults with our bureau as well as a public health nurse, and if need be, we will reach back to our medical director, and should further consultation be warranted, we do have the benefit of US CDC on island, as well as calling Honolulu Quarantine Station, and if not, we will be directly connected to the CDC Emergency Operations Center, which is a 24/7 operations. And the next one I would like to introduce is Dr. Ann Levitsky, our territorial epidemiologist.
Okay, before I get into the criteria for a person under investigation for coronavirus, I want to just put a little context to this 24/7 phone. It's not a hotline for coronavirus. People have been calling it that. I carry this phone with me everywhere since I've been on this job. Past 15 months, I've gotten, to put this in context, 522 calls. During the dengue outbreak, 122 calls were during the dengue outbreak. And in the past 2.5 weeks, I've gotten 281 calls on this phone. Does that mean we have 281 cases of? No. These are just questions, conferring back and forth. A lot of these phone calls are from the CQA folks at the airport, just because they have questions. Sometimes it's the community. And a lot of the other calls I get are not just for outbreaks, they're just normal calls for, from the hospital, if something unusual is going on, or something that might be concerning. So that puts that into context. I do get calls on the past couple of weeks to figure out, do we have a person under investigation for coronavirus? And what we're doing, sorry about this, Mike, we are following the strict criteria of the Centers for Disease Control and Prevention for somebody who might be ill with coronavirus or may have been exposed to coronavirus. Next slide. This is the chart. When I'm talking on the one phone, I'm looking up the chart on my other phone. The person has to have very specific criteria to be determined as a person under investigation for corona. They have to have a fever, they have to have been to China, or they have to have been exposed to someone who was a confirmed case of coronavirus. Next slide. This is the definition for close contact. I'm not going to read it. It's very specific to having been near a person or taking care of a person with coronavirus. None of this has happened on Guam. Next slide. Then we also have some very specific criteria if we find a person under investigation for coronavirus. And you can see it's very specific for the clinical features. Does the person have a fever, cough, respiratory illness, and were they in close contact with someone with coronavirus? Or they can have fever or signs and symptoms of respiratory illness and a history of travel to China, specifically Hubei province, and or respiratory illness that was required hospitalization and they were in China. Just because somebody is vomiting on a plane doesn't mean they have coronavirus. Just because someone has a stomach ache on a vessel doesn't mean they have coronavirus. So those are what I do most of the time in this past 2 weeks, is field phone calls from the hospitals, the schools, the CQA, and 10% of these calls on the one phone the past 2.5 weeks have been confirmed with the CDC, which is Faye Mankind, and another 10% were confirmed with Dr. Manfonia about potential cases. We have not had any persons under investigation for coronavirus. And so I'm going to turn it over to Dr. Manfonia.
All right, so how do we decide if someone is a patient under investigation or a person under investigation? It says detect, isolate, report, consult, test, and manage. Next slide, please. Next one, that's the airport, so let's go to the next one. Okay, we have tried to inform all the providers on what we needed to do. They went over the criteria earlier, and Dr. Ambit, for the detection of a suspect patient. And so we've tried to clear the pathway so that the providers can contact us. What they will literally do is that if someone comes in and says, I've got a fever, I've got a cough, the first thing they're going to do is get a travel history or a contact history. Have they been around anyone with the coronavirus? If they have, then flag goes up. If they've recently been to China, another flag goes up. So for the abundance of caution, we would then isolate that patient, put protective gear on, masks on, which they probably already have on, and we would try to sequester them while we regroup, and we would limit all the contact going into the room. So we have a suspect patient at that point, and so we then have them contact us at Public Health. We will then contact the CDC, the EOC line, and tell them what we have, discuss the case, and get further direction from the CDC. They are intricately linked to us through all this process. And all of our guidelines are coming from the CDC. There's a lot of data out there, and the World Health called it the epidemic. There's so much information, some of it's valid, some isn't, but the CDC tries to distill it all out and guide us on what, and stay the course with something that's proven or scientific at this point. So isolate them, then contact us, we consult CDC, and they will give us direction on how to manage. Next slide, please. Next slide. Next slide. Next slide. Okay, I would like to comment a little bit more. We mentioned this in a radio show that we were involved with, and quarantine, isolation. A big concern is, where are we going to put these people? Well, they said, how many places can we isolate? And I said, how many houses you got in Guam? 200,000? You got 200,000 quarantine facilities. We do this every single day with other infectious respiratory diseases that we have, including tuberculosis. A lot of you all may not be aware, but we have a tuberculosis clinic on every island in the Pacific. We isolate patients and quarantine them daily. And it's not done in the hospital. We just advise people to select a room in their home and stay in there, mask, and if you can use your own restroom, do that. And just try to limit your contact with other individuals until you're not infectious. So for people who are healthy and don't need to be in the hospital, they're not sick, then that's an option. CDC has offered, and again, we haven't run into it yet because we haven't had a PUI yet, a person or a patient or a person under investigation. But that's something that they offer. Not everyone is going to be in the hospital. You have to be in the hospital, you have to be fairly sick. You have to be able not to thrive on your own. But if you can thrive on your own, watch your TV, play on your phone, and just stay out of everyone's way until you're not infectious. Okay, let's see, who's going to be doing this one? Who's up next? Oh, that's all right, that's still mine. Next slide. Okay. See, okay, now we'll have the director. Director DeNorsi will.
Lastly, we want to say that the Department of Public Health, this coronavirus and anything with public health is a community health issue. And all of us are part of this community. We must all put together and work together in times of emergency, such as coronavirus or any diseases or any typhoons. And so we implore you to be part of our team and help us to fight this disease. Thank you.
This Moxie to our healthcare panel. Now it's time to hear from you. This is your chance to ask questions from our healthcare panel. We have two of my co-workers going around, Leanne and Mark. Please raise your hands. They have wireless mics, so if you have a question, please raise your hand, and Leanne or Mark will come to you, and you can ask your question to the healthcare panel. Keep in mind we have another set of panelists that will be presenting right after this, so we'll spend the next maybe 5-10 minutes asking some questions for our healthcare panel, and we'll get through the next session. So who has the first question for our healthcare panel? Please raise your hand. Leanna approaches the first question from Asher, I believe. Just keep in mind as well that there's materials at Public Health that's provided right outside of the foyer. There's through these doors, so make sure you get some materials that you can take back with you. And I'm sure that they'll be able to provide more resources online should you need more. All right, Asher, what's your question?
Thanks for coming and educating everybody on this. My question is, besides it being brand new and we just haven't seen it before and it takes a long time to manifest, what makes it so scary? It seems like it's another thing. I mean, more people are killed from the common cold. So I guess I don't understand why everyone seems to be so afraid. Besides, that's just new.
Why is it scary? Let me give you some numbers, and these will probably make you a little less afraid, but then I want to talk about that too, fear factor. Okay, I was doing some numbers. Okay, let's look at the flu rate in the U.S. Okay, looking at the current population in China at 1.3 billion, roughly, and the current population in the U.S. at 327 million. So we would expect, they're about 4 times larger, so we expect 4 times the rate, all things being equal. And this is just rough estimates. So if we look at the number of flu in the U.S., 36 million. 4 times that would be 144 million cases in China. How many cases as of this morning? They've had 73,000. So how many people get infected from the flu? Usually 2 to 3 from a certain case. An individual case will probably infect 2 or 3 people. They're not certain the transmission dynamics of this one, but it's looking like it might be 4 to 6. So it might be spread a little easier. Okay. Yeah, it's more contagious. That makes it more contagious, obviously. If one person can infect 6 instead of 2 or 3 like the flu. Hospitalizations. We have had about 440, almost 500,000 hospitalizations over 2019 for the flu. At that rate, we would expect 1.7 million hospitalizations in China from this. We've had 14,000. So it's not as bad. It's a little more contagious. The death rate for coronavirus right now, and again, all of this is rolling data. It's going to change tomorrow. But the things that have stayed pretty steady is there's about a 2% death rate with this. And so 210,000. Numbers are good. So about 210,000 will pass with this. With the flu, it's about 5 in 10,000. So it's a little heftier. Keeping that in perspective, out of 10,000 with SARS, how many died? 1,000. So 5 for the flu, 200 for this, about 1,000 with SARS. With MERS, about 3,000. So it was a lot more with the MERS virus. Let's see here, we get about 3,000 for 10,000 versus the flu. Okay, so you look at it and you say, well, it's not that much worse than the flu. So why is it scary? Because it's new. I can't tell you how it's transmitted. For sure by droplet, possibly by air, maybe by touch. We can answer these questions with everything else. And new is scary because we don't know what's next. But it's staying pretty steady, and it is transmitted by droplets. We know that, and they're trying to limit that. But at the same time, I'm saying, okay, don't get real excited because the current data shows it's not that. It's way better than SARS and MERS, a little bit worse than the flu. For the Guam community, probably the biggest concern is that our resources are finite. So if you're in the middle of Dallas and you need some spillover, you can go to a neighboring city and say, can we borrow your emergency room? Can we fly one over, whatever? Where are we going to go? So we're limited. Right now, try to get a bed at any of the hospitals. We stay full with our current level of infection and chronic diseases on the island. So we're at capacity as it is. So our best line of defense is keep it out. I don't have room for you. So I don't care how harmless you are, I got no room for you. So that I think is a bigger factor for people in the health field, because we know we've only got this many things to service that. So I think we took a little bit of a hit in the press on this recent Westerdam. I don't know if you followed the cruise ship that the governor wisely said better take a pass right now. And I'm sure some people are like, oh my gosh, you know, this is terrible. And then when you read the stories now in Asia and Bangkok, they're like, turned away at 5 ports. Well, you know, when people dock, they have expectations of a certain level of care. And if we can't deliver it, I can just see them saying, why didn't you tell us you don't have a test on island? Why didn't you dock here? You know, we can't meet their expectations right now because we can't test for it. We can send it off to CDC, and we will be on our feet with testing soon. But can we test an entire ship? Probably not. It would be catastrophic for us to end up like Japan has with the Diamond Princess. I think we can all realize that. And I mean, they have what, 200 to 300 cases on that ship. I don't hear anything out of Japan going, oh my gosh, we're overwhelmed. I haven't seen a single article. 10 cases would overwhelm small islands. And so we just need not to go there. We already know what our capabilities are, and yes, we're ready for it. But where Japan could weather a bigger hit, you know, they still have turned away the ship. Philippines turned it away, and a lot bigger places did. But what they fail to mention is the resources we have here, we already know our limitations. And so I don't feel like we need to be in the mix with the big boys that turned it away. Thailand turned it away, you know. So then Cambodia, to finish that story, I guess everyone's been reading, Cambodia, Prime Minister greeted them and handed them roses and said, we love you. You know, all these other places have said, bye-bye, we love you. Well, they probably loved them until one came off with corona. And ended up in Malaysia, and Malaysia's like, oh my God, because they let this person go out into the community, no quarantine. So now Cambodia's trying to scramble, going, where is everybody? We need you all back now. And Malaysia said, don't send us one more. They banned them. So where's that rose now? You know, so that was such a wise decision, because yes, there was corona on that cruise liner, and we might had our wonderful governor not protected us, we might be in the same position as Japan right now. And can it be handled? It can be handled by bigger places, but Guam is not that large, and our resources are finite. And we need to focus on our own community, and our first line of defense is keep it out. So, did any of that answer your question?
If I understand correctly, the reason people think that it's scary, particularly for Guam, is by virtue of being an island, we have limited resources, so it's more difficult for us to handle the normal thing, which makes sense. And then it's new, so anything new seems spooky. But besides that, it's just a slightly worse version than the flu.
Right,
Okay.
and where we are, you know, I don't think we would have the fear factor if we were sitting in Maine right now.
I agree.
Okay, does anyone else have a question for our healthcare panel? Please raise your hand. Our coworker Craig right there. Okay, we see you. Please state your name and who your question is directed to, so we can best determine who can answer your question.
Hi, I'm Fletcher. I guess anyone can answer this question. What I just wanted to just bring up was you mentioned about the test kits, and I just wanted to know whether or not how long it takes, because timing is always a key factor determining the virus, because we want to control. The more you have control of the timing of how long they've been infected, also can mitigate the risk. Likewise as well, I mean, I heard even the last meeting was mentioned they had a possible cure. I don't know if there's any development on that. And another question was, what is the cost of hospitalization? We have fear of people having to go to the hospital because of expenses, or also possibly fear of panic, just like everyone was talking about that one guy that panicked and didn't want to go to the hospital. hospital and get checked up? And what is the answer to that if they have fears of expenses as well?
Okay, I'm going to answer the question about the test kits. We're expecting them anytime. We already released the press release last week, so anytime between that week and this week. So we're just waiting with CDC to send us those kits. We're ready to test for them. Hopefully that the test kits will be validated to make certain that it's not an inconclusive type of test. In other words, the test kit works very well. If it doesn't, then we have to return it within a week. We should get that. So that is the first answer to your question. In terms of a cure, I'm going to share this answer with Dr. Mengonia. They have looked at other countries that identified some HIV medications to try and cure, and they found out that this medication worked for these patients. And so Dr. Mengonia can elaborate a little bit more on that.
No cure yet. Thailand was doing some studies using, well, what is it? This virus is a retrovirus. So is the HIV virus. So some bright person said, why don't we try those meds on this? And they used some antiviral medicine, HIV medicines, and flu medicine. And as of last week, they were having pretty good results. They had 6 people that walked out of the hospital and tested negative for the virus. And they said that one of the, and this is from Bangkok News, so it's as reliable as that is, but they were quite excited because the 6 healed and the 70-year-old was hanging by a thread and she walked out. So they were thinking it was promising. So I'm sure that a lot of their studies are centered around that. Vaccine possible, there was a, 6 months to a year, some promising results from Hong Kong and Australia, but then it has to go through the rigors of passing the FDA and making sure the studies prove it out. So,
and the vaccines are there so that it just builds up your immunity in your body. Usually your body, any foreign object that enters will have resistance through antibodies that will be the fighting mechanism. That should be in place unless your system is immunocompromised, in other words, that's attributed to diabetes or any cancer or any other comorbid conditions that you may have. So the vaccine is probably the best bet as far as having your immunity built, some resistance to the actual infection when it does occur.
All right, we'll take one more question from our healthcare panel. If you don't have any more questions, we'll move on to the next part of our session, which will focus on the government and private sector. So if there's any more questions, please raise your hand. Okay, all right, so Jay.
Given your understanding that this virus is similar to others, what is your best estimate in terms of its life cycle? How long is this process of ensuring that traveling is safe, that coming to Guam is going to be safe? How long is it going to take, do you think? What is your best estimate?
Yeah, I'm going to answer it in a different variety of ways. It's just like any other infection. The only way we're going to know is how it progresses, how many people are infected. I'll go back into the dengue infection that we had. We started in 9/11, the exact date, and we're now in February, and we're about to have a closure on that one. That took about 6 months. So it's really unknown at this point. It depends upon how many people are infected and how our ability to control it and to prevent further spread. I've read in other journals in other countries that they're saying that February, the end of February, going on to March will be starting to peak, and possibly in April. That's all I've heard, and that's all I've read. And so with due diligence as far as everyone contributing in all the U.S. states to control it, meaning have home isolation, quarantine, isolation, which they're doing that as we speak with all these airlines going to these different locations. One went to El Paso as of yesterday, and the other flight went to California, Fairfield, California. They are being quarantined with those vessels that landed. So it's all going to be our due diligence for infection control and also to do home quarantine isolation to keep it out from the entire community. I hope that answers your question.
So you indicate that we should be planning for business. This will last at least until May.
I would say just we're on our guard, and based upon what I'm reading, just be prepared. Yes, and we're going to be very realistic. We're preparing right now as if we're going to get it, and that's how we're going about in our preparatory. We're facing it. We're doing all our due diligence to get additional manpower from all the different resources in our community, and that's where we're headed. So again, it took us 6 months for the dengue. If we do very good infection control and we do our due diligence to do surveillance and contact follow-up of a case that is infected, then we can do our part to ensure that it is not spread further.
Okay, I know that I saw another hand that was being raised. Okay, that'll be our last question for the healthcare panel because we need to move on into the next session. So we'll go ahead and state your name and your question and who you want to direct it to.
Bruce McKenzie, I guess to the Ports Authority, and the question is, are normal scheduled cruise stops still being allowed, or are they being restricted?
Yes, the vessels that are coming in down at the port are still allowed to come in, other than vessels that are originating from China, to include transiting other areas throughout the infected destination. But yes, they can still come in, other than calling the ports from those infected areas, and that is China right now.
Okay, that's a great segue into our next panelists. So we'll hear from our government partners as well as from the Guam Hotel and Restaurant Association. So let's continue on with our panel. We'll start off with Mr. Tom Atta, Executive Manager for the Guam International Airport Authority.
Thank you. I just want to make 5 points and then segue over to customs and quarantine. First of all, at the airport, obviously we are feeling a little bit of the impact from the cancellations and from a reduction in the revenues and the enplanements. However, that impact has been mitigated somewhat by the fact that in January, projections were exceeded considerably. And so we're kind of riding off of that surplus. There has been a decrease in revenues, which means then that inevitably we're going to have to take a look at our capital improvement plans and have to defer some of those projects. But rest assured that despite the fact that we're going to be deferring some of these capital improvement projects and other projects around the airport, there are certain imperatives that will not be compromised at all. One is we will maintain the security requirements of the airport. So you go in to depart, you have to go through TSA. You arrive, you have to go through customs. Those things must happen and will continue to happen. There are also requirements from the Federal Aviation Administration, which must be continue to be maintained if we're going to meet the standards of operating the airport as required by the FAA. So those won't be compromised at all. Although the traffic has decreased somewhat, for example, and kind of try to refrain putting out numbers because the numbers from the airport are somewhat different from the numbers that GVB is reporting, but I think it's just a matter of reconciling what the reporting periods are and whatnot. But we're pretty sure that so far, up to the month of through February, we know of about 11,000 cancellations in seats. That, of course, translates to a reduction in revenues and reduction in traffic. So there's another measure that we use is that every day we receive statistics from TSA, and so far as the number of projected outbound passengers. Just about a month ago, we were seeing anywhere up to about 3,200 departures during the period of 1 p.m. to about 4 p.m. That number has now dropped to about, the last number I saw yesterday was around 2,400 passengers departing. So clearly there are measures to show that there has been a reduction in the traffic. Now, I guess we can do one of several things. We can, we can kind of really tighten our belts and just like kind of hunker down. And because we don't know when this thing is going to be over. And we're kind of approaching it differently at the airport. We're going to take this slow down to be able to take advantage of the opportunity. Start doing some facelift. Our curbsides haven't been painted in a while. I think the airport should still be a place that when you drive up to catch a departing flight, it is still, a bright place that will stick in your mind that Guam was nice. We want to make sure that our facilities, when you arrive, continues, that we will have carts there, that the bathrooms are clean, that the toilets are working. Those are the things that the passengers are looking for. And so we will continue to work on those things. Now, the last point that I want to make is the role that the airport plays in this whole thing, right? So there's the airlines, there's customs and quarantine, there's the immigration, and then there's the Department of Public Health. And so the role that the airport plays is basically we receive word from customs and information that on this flight there are persons of interest. For example, on February 2nd, when a plane pulled in and there was 20 passengers who came from China. And so the information was made available to the airport. And based on the procedures that have been agreed to, then you contact public health and they get alerted to come up that we need to do some screening. The airport is required to establish an isolation room. Now we've gotten calls from some of the media asking, can we see this isolation room? And I think there's the expectation that you're going to go in there and there's cots and basically a dispensary type of setting. It is not. It's an isolation room. We are able to take passengers from the airplane, put them in a room where then that is set up so that public health can come in and do their screening, so that customs can start doing their initial information intake and whatnot. And this room, really, as long as it meets certain criteria, it's got to be close by to a restroom. It's got to be large enough to be able to hold 30 passengers, which we were faced with, or one passenger. And then, of course, when that happens, then we basically tell the operations superintendent, we're going to need this room for several hours. If you got an airplane scheduled to come in, reroute them to another gate or whatever. And so that's the role that the airport plays in this whole scenario. We just basically take them off that airplane, isolate them in this room, turn them over to public health, have them do their screening, turn them over to the next regulatory point, customs or immigration, and have them do their jobs, and then then the whole thing just basically takes its natural course. So that basically is what I wanted to pass on to you. And I don't want to take away any of the thunder for customs, and they'll talk about basically what they do as a regulatory agency. Thank you.
to Senator Tom. Thank you so much for that information. We'll have our next panelist come up. I know that he mentioned that Customs will talk a little bit about their role in that. So,
Thank you for giving me the opportunity to be here. My name is Ike Paredo. I'm the Director of Customs. And I would like to just emphasize that one of the mandates for this agency is to prevent the introduction of communicable disease into the area. And of course, we're here today because of the coronavirus. But let me start off by saying that as the agency continues to dwell on this particular situation, we've been working closely with the airport authority in making sure that whatever protocol that we have established, that we should follow that protocol, because this is the reason why we have planned for this particular protocol to include public health. We've been communicating with them and collaborating with them since day one that we received information about this particular disease. More importantly, though, we got to make sure that we protect our people from all these particular aircraft and dependencies that are calling our ports. And the first thing that we did was we required all aircrafts and vessels that are calling our ports to sign a declaration stating that there's no sick passenger or crew on board their aircraft or vessels as they call our ports. Now, because of the ban,
one moment, we're having technical difficulties.
Yes. Okay, more importantly, the biggest concern that we had was how do we identify who these passengers that are coming in. And when the ban came out, it was very, very clear that non-residents originating from China are not allowed entry into the United States. And that was very good news for us. But the other part that we're concerned with was the residents, U.S. residents that are returning from these particular places, because according to immigration, they will not deny them entry because they're U.S. citizens. And so we have to ensure that we understand the protocols of how to treat this particular passengers as they come in. And it was clear from the federal government that the protocol is that if a returning resident originated in China that the airlines are responsible in making sure that this particular passenger is routed to one of the 11 airports that are designated throughout the United States, which is fine for us. Our concern with this is that Guam is considered a destination for other foreign countries in which these passengers are able to transit. We have flights coming in from Japan, we have flights coming in from the Philippines, Taipei, Korea, and a lot of these passengers are transiting this particular destinations that we were concerned with. And so what we did was we started working with our counterparts at the airport, the U.S. Customs Service, CBP, Class Immigration, and they provided us information on all passengers that are traveling or originating in China destined to Guam. So that means that we can track all these passengers as they come in, regardless whether they transited the destinations in which planes are landing in the airport. And so they have really helped us improve our vetting process for these particular passengers. And so what happens at the airport is that should a passenger slip through the cracks originating from China, we were concerned because some of these passengers were flying from China to Japan, to Hawaii, and then heading back to Guam. U.S. Immigration has assured us that all of these passengers that are transiting Japan to Honolulu are vetted and are processed so we don't have to worry about these passengers when they come in. Now, if we have passengers that are coming in, transiting Taipei, coming to Guam, then CBP will notify us at least 2 hours prior to the flight landing at the airport. And what we can do is we can identify all these passengers, put a mask on them, route them to the isolation facility that's provided by the airport, and then call public health to start the screening process. And that's the procedure that we're following right now. In addition to that, all passengers that are passing through our ports are provided with information such as yellow cards that are issued by public health, letting them know that should they feel sick within the 14 days, that they should be able to report to their healthcare facility, and hopefully the public health will be able to identify them. In the meantime, we also track all these particular passengers by making sure that the manifest that we have for that particular flight is available should public health request for the information. And lastly, the only thing I can say is that although we have flights coming in from the airport, we also have passenger vessels that are calling our port down at the Port Authority of Guam. 3 weeks ago, we had a passenger vessel that came in from Hawaii, Marshall Islands, into Guam. And so they were clear because they have come from an area that is not considered to be infected by the virus. But we do understand that we have a lot of these cargo vessels that are calling our ports, and we do follow the protocols that we have in the Port Authority of Guam. So we're covering all the ports of entries as it relates to not only passengers, but vessels and aircraft coming in. Thank you.
Cesar Zamasi to Director Pareto. At this time, I'd like to also invite Chief of Customs Vince Perez to also add on to some comments from Guam Customs and Quarantine.
Good afternoon, everyone. My name is Vincent Perez. I'm the Chief of Customs. And so I'm just going to touch a little bit about what we do. But I think many people don't understand what the background is of customs or how we actually interrelate. So if you take a look at our name, the name of the agency is the Guam Customs and Quarantine Agency. So what we do is we enforce not just for drugs, not just for taxes, not just for consumer products, not just for agriculture. That's a short list among other things that we're tasked to have vigilance over. So today we are here to talk about the novel coronavirus. So among our mission is to protect the island from these public health risks. So we collaborate and we act as an agent for many different entities, not just federally, but most especially and more importantly, locally. So we collaborate for public health. So as an agent for public health, we have these protocols, and I know you've heard it before. And so just so you understand, our officers have received training in assessing and identifying potential risks, starting from the time that they board a vessel or an aircraft. So it's not just aircraft, it's the vessel. And so I think I have to digress a little bit. So we have customs officers at the airport, but we also have customs officers who are assigned at Anderson Air Force Base, and we also have officers who are assigned down at the Port Authority, and we also have officers who travel to the different marinas for whenever any type of vessel or conveyance comes in. So part of the training that we receive is done by public health. So what we do is we interview whoever the master is or the crew member. And so I'm going to use the aircraft as an example because that seems to be the biggest concern so far. But we have had, just the other day, we've had concerns about potential sick crew members. But I'll touch on that as well. So just to reiterate, this is a regular process. If you guys were here several months ago, we had the concern with the dengue concern. I was at that same venue talking pretty much about what we do, and our process really has not changed. So we work directly with public health, and there are protocols and procedures that have been established many years ago. And one of the things that we're always looking to do is how do we improve upon the process. So here we are today. We're looking at some of the things that we've experienced along the way. And a lot of the times when we're talking and we're providing information to public health, we have to be concerned whether or not are we overhyping it or not giving it enough attention. So there has to be a balance. So since the coronavirus, we've actually worked much more closely with our stakeholders. So we've worked closely with the U.S. Customs and Border Protection to track the arriving passengers. We've worked much more closely with the airlines. We've worked a whole lot more closely with the Guam International Airport Authority. And most importantly, we've worked much more closely with public health to establish or improve our protocols. So I've said that I'm not sure if I need to go over the boarding procedures, but maybe I should just so that you guys can rest assured that part of our process is to ensure that we are taking care of public health concerns. So at the jetway, we meet the aircraft, and before the door is open, the officer already is thinking about what the potential impact is, right? So he goes over and he has to make sure that If the jet needs to be cleared, and the only person that needs to be there is the agent, it would just be the agent and the customs officer. The customs officer will tell the agent to have the aircraft door open. They open the door. The only one that's talking to the crew member will be the customs officer. The customs officer, by virtue of his authority, will ask questions dealing with the health and safety of the people on board, including, but not limited to, asking questions about the health of the passengers. So if there are no issues, then the passengers will deplane, and they go through the rest of the process, which is to go through immigrations and then finally through customs. If we identify there is a sick person on board, we have to dig a little bit deeper. We ask a little bit more questions. Now, if it gets to a point where we feel, and a lot of times it doesn't take much to trigger it. If there's a sick person on board, we find out what the symptoms are, and so we go into the, it's kind of like a quarantine process to a certain extent. We will contact public health and let them know that we have a sick passenger on board, and we have 2 isolation areas. In case you're not aware, one is, I guess, at the spur of the moment, which could be one of the gates that's not being utilized. But down in the Guam Customs and Quarantine area, there is a room that is specifically designated as a quarantine isolation room. So if it gets to the point where we need to isolate, we do. So when we get the passenger, right now, because we've evolved just a little bit further, we actually get gloves and masks. And what we do is when we meet the aircraft and we know that there are sick persons on board, we will give those masks and the gloves and make sure that they are masked up, and we do the same thing. We put on our PPE and we start to do the interview process, and then we escort them with an agent to an isolation area, and we make a contact with public health. Okay, so all the while that we're doing that, and we allow the rest of the plane to deplane, to disembark, down in the customs area, if you guys haven't already seen it, we've got these cards that are going out, most especially made for the coronavirus. But aside from that, we have the regular public health alert notice that we also give out as a part of our process, even regardless of the alert that we're having with the coronavirus. If there are people that are sick on board and it doesn't meet this level or threshold, we've been issuing these as a matter of course. So as we continue to evolve our protocols and our procedures, we're going to get better at what we do. And so we just want to make sure that because we're in an ever-changing and very dynamic environment, that we're able to keep up with the demand. So we're wanting to make sure that we're doing this to protect our people, our island, and our resource. Thank you.
Cesar Masi to Chief Paris. All right, and now we're going to be hearing from the Guam Hotel and Restaurant Association President, Ms. Mary Rhodes. And shortly after this, we'll have our final Q&A session, so make sure you get your questions prepared, and we will conclude our briefing around noon time. So again, give it up for Ms. Mary Rhodes.
Hafney, I know it's kind of a long morning for everybody now, but I really appreciate everybody who is here. This is the second briefing we've done. GHRA hosted one together with GVB 2 weeks ago, and we had all of our representatives, and so it's really good that we continue our communication and update everybody. But you wonder why GHRA serves a role in this, and just as a reminder for those who don't know, my name is Mary Rhodes. I'm the president of GHRA. I've been with the organization 14 years now. But GHRA is your non-government organization advocate that it works on behalf of the private sector. And it's very important because for about 48 years, we've been sitting together with GovGuam serving as that advocate on behalf of the industry, where we actually participate in the Emergency Operations Center. We have a RAC, which we sit with together with GVB. So I'm Keisha's backup at the EOC at Homeland Security, and then of course we work with Josh in the Joint Information Center. So throughout this entire situation, but also in any type of emergency management situation, we are there for you, and we want to make sure, remind everybody, I'm really glad Gerard participated in a focus group yesterday for GVB, and we do have a safety security committee, but I'm really happy to see a lot of sales and marketing folks as well, and not just hotels and restaurants, but we have retailers, wholesalers, transportation, so it's really good that a lot of people are here, because we all are impacted by this. As much as we don't have a case here on Guam, we are definitely feeling the impact. But we have to kind of keep things in perspective, and it is everybody's job, those are as professionals in this industry, that we help manage the situation and we work together. And by managing it, we need to know what we can control, what we can't control. And what we can't control right now is a lot of the information that I'm sure we're all inundated with. So we need to make sure that, yes, we do follow CDC, Centers for Disease Control, on this information. We're not following the World Health Organization, we do follow CDC. And so when you are sharing information with your employees or with anyone who's considered a stakeholder, or even your families, please keep in mind, of course, public health, they do share information on the CDC, and those are the protocols they do follow. But we've also been sharing other information that's really important for the safety of yourselves, your employees, your families, and that's a lot of stuff that we have to just train everybody on, even as simple as washing your hands. I know we take that for granted, and sometimes it's a simple thing, but it's extremely important anyway in the food service industry especially. But it's just important overall as we need to ensure that we have precautionary measures. But the market conditions have changed on us, as we've seen, and unfortunately, even with the recent announcement with some of the flights that are being suspended with Korean Airlines, I think that we all have to really take the time to understand what this is going to mean for Guam. And it is not a short-term thing. We have to look at it when we've reacted or what has happened over the years with other types of outbreaks or situations. Imagine we're finally having an upswing on our Japan market, and from the North Korean crisis, that took us about 2 to 3 years. So it has been a really good time for us, and I think that the Korean flights are going to impact us tremendously. I think that people in general are going to choose not to travel, which is what's recommended anyway. So I think people will practice safe measures on that and make good decisions. But at the same time, with 60% of our GDP relying on tourism, we are all going to be impacted one way or another. 35% of employment here on Guam relies on tourism. So you all have to take that message back to your management teams and really start planning ahead. Don't do this just for coronavirus, you should be doing it in general. And this is what we try to prepare everybody throughout for different scenarios that we've always had to face for the tourism industry. The other things we can affect are, of course, all the global situations around us, but just anything that globalizes, we have to react appropriately. And I think that Guam has stood up for it. I think that we continue to manage it on a regular basis. Thank goodness we have not had a situation, but I know there have been a lot of questions of why aren't we doing certain things. But I think first and foremost, we've always made sure that we consider our residents and our tourists being our key our number one economy for the industry, for the island. But we also have, when tourism has been down, we've also had another piece of business that continues to keep us up, and that's been the military. And so if you haven't noticed, this last month, as we've been dealing with coronavirus, we've had a drop in arrivals, yes, from key source markets, but we've also had some activity because of the military exercises taking place. So regardless, the people in this room continue to provide a great service to Guam. And I think that we all should recognize that first and foremost, and that it's not business as usual, but I know that everybody continues to work hard to make sure that they're providing that service. But we're really here to share information and to make sure that we address anything that does come up. And there are going to be several months of continued downturn. And I think that's what everybody needs to walk away with, is you need to prepare, just because that is just the natural occurrence that takes place when you have a situation like this. But how long does it take? Until there's a vaccination, until there's a cure, there's really no way to put a timeline on it. There isn't. And you also have to consider a recovery period. We have taken, if you look at SARS, there was a 28% drop after SARS worldwide. And it took another 6 months for travel to go up. Just people don't travel during that period. So we have to keep things in perspective for Guam. But the most important thing we can do is do the things that we need to do anyway, which is educate and train our employees, prepare everybody financially that it's going to be tight and there are going to be decisions made. And yes, although Golden Week is in May and we're supposed to have a great Golden Week, the projections for the next 3 months aren't great. And so we have to be realistic on what we can manage. So right now, between now and the summer months, it's really going to be about pricing. Pricing and RevPAR and ADR, our average daily rate and occupancy. How much of that can we manage and continue to keep the economy going with the markets that are currently traveling today? How much of that can you anticipate to carry over for the next 6 months? Because then we'll have another peak season. Summer for our Asian customers are later in the month. It's not like the US where that's in May and June, July. We have a couple months before we have to really address that. So right now the projections in the next 3 to 6 months, we have to really work with all of our partners, our stakeholders, to continue sending out the message that Guam remains free of the coronavirus, but we are working diligently to make sure we are taking the precautionary measures with everybody on the island to make sure that we're doing all that we can to remain free. And so you need to go back and really educate your employees on what is truth, what is myth, and really conduct training. Because as much as we have sales and marketing here to send out that message, and GVB has that messaging in place, we also have to think about the operations and our employees. And so even with security measures, we have to look at things that really affect us. As much as the media is here to provide information, we have to also manage our messaging. So there's a lot you can do with your employees, even with social media policies. There are things we should not be sharing or continuing to also overshare when it helps create panic. And so remind your employees about social media policies and phones in the workplace and things like that, because any small message that goes out that is not controlled by corporation or by GVB or public health or any of the entities here, I think can hurt us. And so we have to be diligent even at that, not just about good healthcare practices and good hygiene practices, but also good management practices. And I think that's the message we all have to walk about with today, are things like that. There are travel cards that we're giving to the tourists. We've given that to our front desk representatives. We shared that our tourists do have to travel. We've worked with the government to identify even the Airbnb homes and short-term vacation rentals to make sure that we get information out to them, because they don't have the front desk reception area. So we do have to work with government to make sure our short-term vacation rentals are covered, to make sure that those tourists who are staying in those facilities or those buildings also understand the number, or they know the number that they can call if in case they need any assistance or even just monitoring. But right now it is about making sure your employees are prepared and your management teams are prepared. So there are a lot of precautionary measures. I know we talked about good hygiene, but also updating your plans. That was a key thing at our safety briefing, is taking your pandemic plan, updating it, but also working out different scenarios so that you conduct real life scenarios so your staff are prepared when they're wondering if somebody needs assistance. You need to know where your isolation areas are, if in case you need to call public health on site to do any assessments, any monitoring. You also need to have quarantine rooms if in case you do have a situation and you need to send out the test kit. So all of those things we've talked about, we've practiced those scenarios. We want to make sure you're continuing to do that because right now, as we have a downtime coming up for us, it's time to really just reinforce some of the messaging and the training and really get your employees to understand the importance of not only just PPE, but also bloodborne pathogen. How do you control anything, whether it's questionable or not? There are certain things that they should know and should have training on, and those are federally required anyway by OSHA. So you can reach out to GHRA, we can get you assistance if you need trainers to come on site. We will provide those training programs for you immediately, but there's a lot of resources available out there, and we can help manage that information. But more importantly, work together so that if there's anything, any question you might have, you need to really raise them. Maybe not in this public setting, because I know a lot of people may not want to bring this up, but I'm certainly always available. My phone is actually 24 hours, even though I'm not a government employee. But you guys can always reach out to me. My number is 687-3633. And GHRA does assist, again, with any of the agencies. I know I've been working with Linda a lot more lately. But it is something that, there are a couple of things